I'm going to move on to the workforce. Obviously, Skills for Care did a brilliant State of Care report last year, which I've brought up at this committee a few times. One of the things that came out of that was the 8.3% vacancy rate in social care, so 131,000 vacancies in adult social care. What is it that's driving these vacancies?
So what's driving the vacancy rate is really two things. It's attraction and it's retention. Yeah. Some of the vacancy rate is really positive. So some vacancies are really good. It's because of, it might be growth, additional needs being met. But our report shows that the vacancy rate in adult social care for the full year that we have the data, up until March 2024, is about 3 times the national vacancy rate. So while some vacancies are good, it's still much higher than the kind of general economy. So there's probably 2 questions. The first is what stops people coming into social care in the first place in terms of roles. And we know from our data that the biggest indicator of whether a provider is going to be able to fill vacancies is the ability to compete in the local labour market. And that does include pay, but it's not just pay. It's how we talk about social care, it's how we value social care, it's differentiating social care roles from other similarly paid roles. And that... So when we need to tell a different story about social care as a society and as a sector, and we're starting to do that. And I think that when we look at the Secretary of State saying, this is a growth department for the Department for Health and Social Care, I think we're saying that more and more. I think the sector is saying that more and more, and we can do more to talk about social care in a really positive way. That there's a high vacancy rate, about 131,000 vacancies in any one day. Well, let's start talking about that as 131,000 opportunities to work in excellent roles where we can give purpose and we can give flexibility. They also need to be good quality roles. So there's an element of competition in the local labour market and the view of adult social care. Even when we do get people in, because we recruit a lot of people every year, more than 300,000 new starters in social care, but we've got a bit of a leaky bucket, so we don't keep them. And even though turnover has reduced in the year 23-24, most of that is down to international recruitment, because international recruits are less likely to leave their roles in year. Our data, which we collect from the adult social care workforce data set, which covers just over half of the sector, when we did some analysis looking at what are the factors that influence turnover, if 5 conditions are in place, then turnover halves. So if somebody's on higher pay, if they are not on a 0 hours contract, if they are able to work full time, if they have access to training and a relevant qualification, turnover goes from 40% to 20%.
I think that's reasonable. I used to be a cabinet member for social care. Like many on this committee, I'm a recovering local council cabinet member. We tended to find people would come in from retail and leave to the NHS. We talked about the 8.3% vacancy rate in social care. I think it's 2.3% in the NHS. What do we do to make social care a bit more sticky then, and make it, and not, you talked about the training. We found we'd give people brilliant training and then they could go and be HCAs on NHS pay bands.
Yeah, I mean, the Health Foundation did some research that showed as a sector, when people join us in social care, they're more likely to join us either from another social care organisation, because about 2/3 of people will be moving around the sector, but they're more likely to join from hospitality and retail, and more likely to leave for another caring profession, which includes children's care and the NHS. An element of that is pay. So a healthcare assistant with 2 years qualification will get about £1.45 an hour more than somebody working in social care. We've got to embrace the fact that as social care, we've got a lot to teach as well as a lot to learn. And in social care, we see people's needs through the lens of their whole lives, not through the lens of a disease or the lens of a health need. And so the benefit benefits of people spending some time in social care is absolutely massive when we look at the prevention and personalisation agenda. But what we've got to do at that system level, so at the ICB level really, is to make sure that when we're looking at one workforce, that it's not just a one-way draw, that we are, where possible, aligning terms and conditions, making the roles as attractive in social care as health, and sometimes making the most of that transition between the two, but so that it isn't just one way.